So in the past month, I've had 2 patients come into the office that were scheduled to either have steroid injections, epidural injections in their lower back, and or surgery on their lower back for a herniated or bulging disc. Each time they came in, we sat down, we had a detailed consultation. They reviewed their history with me. I reviewed their MRI with them, and I gave them an alternative. Epidural injections have a lot of negative side effects to your body as well as negative side effects to the disc. It helps to demineralize those bones, and it turns that disc material more acidic where it starts to rot. Surgery, everybody knows all the complications that can come from having surgery. So in our office, if you have a herniated or bulging disc, we start off with the soft wave. That is one of the key things to treating the disc in our office, and this is what helps us get such great success. But we've got a lot of other things in the office that we do for a herniated or bulging disc, so take a walk with me and let's show you these things. Chiropractic adjusting is vital to treating a herniated or a bulging disc. So we use our Pro Adjuster machine to take a scan of your entire spine and make sure all those vertebrae are moving as well as they should. But what a lot of people don't realize is if your pelvis is off balance and you have one leg shorter than the other, that herniated or bulging disc is never going to be able to stabilize. So we need to make sure that your hips and your pelvis are balanced as well. The other major part of our program is lumbar decompression therapy. Decompression in our office is a 24-minute or 24-cycle treatment program where the table is pulling at 85 or 75% of those forces directly on the disc that's involved based upon the angulation of the table, but it is pulling for 45 seconds and rests for 15 seconds. We do this back and forth 24 times to try to increase that movement of that disc, increase the movement of this vertebrae. It helps to get the pressure off of that disc, and we can start to stabilize it from there. Besides the Lordex decompression, we also use the back on track decompression. This helps to stretch out your spine and then rotate from side to side, just trying to get those quadratus lumborum and those glute muscles a little bit more stretched out and a little more pliable. And last but not least is our Hakamed, which is an advanced form of electric stimulation that will help to, and you can see all the things on this little flyer that the Hakamed does, helps regeneration, increased circulation, anti-inflammatory, pain relief, and muscle stimulation. This little device is amazing. We've got other things we do, just some other passive modalities and some other exercises that we'll recommend for home, but we've got a thorough program for your back if you have a herniated or bulging disc. So hit the link below and give us a call.